fast, staying on your feet with this power you can't be beat. DHA, the athlete's choice. Heart and brain, let's raise our voice.
Hello, I'm Bassam Hallak from Omega Ingredients, and welcome to The Good Oil, our podcast series where we explore the intersection of science and sports. Our goal is to educate and create awareness about the role of DHA and omega-3 in sports science for elite and active individuals. In our first podcast, Greg provided us insights on what are long polyunsaturated fatty acids, or PUFAs, and how are EPA and DHA unique compared to other fatty acids. Today, we're diving into some fascinating research that highlights a crucial role that DHA plays in enhancing sports performance. What does the latest science say about how DHA supports athletes and their training outcomes? I'm thrilled again to be joined by Dr. Greg Peoples, a distinguished research scientist from the University of Wollongong. Greg has dedicated much of his career to exploring the impact of DHA and EPA on human health. Welcome, Greg.
Hi, Bassam. Great to be back and looking forward to another chat on this topic.
I've really enjoyed your first podcast, and I'm looking forward to this podcast as we explore about the benefits of DHA in sports science. Your recent paper titled Omega-3 Status for Physical Training and Competition, How Does the Overall Evidence Stack Up? Provides a comprehensive review of this topic. Can you give us a brief overview of what you found in the research?
Yeah, so it's a review that we've recently published. It's not the first review on this topic, but I took a very different approach to previous reviews. So what we have to consider first is you can review the literature in a couple of different ways. Up until now, we'd seen what we call thematic reviews on omega-3 and sport, physical performance athletes. And the problem with thematic reviews is they don't really sort of narrow down on the papers that are most likely to give you a really good answer. And they also don't critique the papers in terms of the study design that they use. And it's a really important thing with study design and omega-3s. So our review took the approach to say, let's do a systematic literature review and make sure we only have studies that are involved with trained populations. It's difficult to have elite populations in this. It's difficult to do studies on elite, but at least let's make sure the participants are trained participants. They're not sedentary, for example. And we also wanted to make sure that they are studies that were specifically targeting an omega-3 and not mixed up with other micronutrients, for example, because that can get really confusing as well. And so what we did is we collated those studies and we ended up with 46 papers. And we took the point of view of actually critiquing the study designs rather than focusing on the outcomes straight away. We said, well, what's the quality of this research? Where previous reviews had always looked at each of the papers and said, well, this is the outcome. It improves this or it doesn't improve that. The problem was that if the study was designed poorly, well, it's probably a false outcome in that instance. So our major outcome was that over the last 2 decades, there's been a rapid increase in the number of studies that have focused on omega-3, whether it's EPA or DHA. There's been a mixture of studies that have focused on EPA or DHA. Most of them have been kind of the classic combined fish oils, inverted commas, which means that there's a combination of, you can't split those two fatty acids up in terms of their role. But we also noticed that although they often, 50% of the studies followed standard protocols for good study design, randomized controlled trials, for example, there's a lot of subtleties to omega-3 research that make it quite difficult to pull apart the outcomes unless you've actually designed it based on an omega-3 study design. Now, what do I mean by that? What I mean is that omega-3 is already in our diet. And so if you don't carefully design a study that looks at your participants to start with, allocates them into groups, make sure that you are not bringing people that are already supplementing, for example, you can end up in a real mess. And what's really critical is you need to use the biomarker to actually demonstrate that your omega-3 supplements had an impact. And many of the studies that we reviewed out of our 46 didn't use a biomarker, or if anything, they were only tracking it, say, using plasma. Now, we talked about in a previous podcast that, well, plasma's better than nothing. But what happens if you just swallowed 3 or 4 fish oil capsules in the morning that you'd had your plasma sample taken? You're probably going to look better than what you really are if you haven't been taking your capsule the whole
Yeah.
time. So overall, our outcome was that we're in a situation where we've now got 46, probably now, this is a year or two old, we're probably in excess of 50 studies, but we could do a lot of improving in terms of being able to design them properly. One last point I would make in terms of the biomarker, when we then get to the end of your study, you've got to make sure that the participant's been taking the supplement. And what's really important is that you split your control group
Mm.
from your intervention group, because you can still have people in your control group consuming DHA through their normal diet.
True.
Yeah, so we've got to make sure those two groups are split, and you get a very distinctive difference in the omega-3 index, for
Yeah.
example, in
Yeah.
those study designs.
We were talking a bit earlier in regards to the historical um, research on omega-3 and on obviously the first significant paper on omega-3s and exercise physiology was published in the 1980s. How have perception and evidence about the role of omega-3 in athletic performance evolved since then?
Yeah, it's a good point. And look, a lot of people are either not aware of this study or they've overlooked it. So it's a study by Alexander Leaf, and he's a giant in omega
Yeah.
3 back in the 80s, particularly around cardiovascular disease. And in this particular study, um, he supplemented trained athletes, but there was a mixture of athletes in his study. Some were cyclists, some were runners. He supplemented them on a EPA rich oil. There was a little bit of DHA in there, but it was EPA. He had them on two groups. He had what he called a high and a low. Now, what's interesting is his high group consumed 12 fish oil capsules per day, and his low group, inverted commas, consumed 6. If you actually look at the number of, the total milligrams, his low group was already consuming 3,000 milligrams, and his high group was probably in excess of five,
Yeah.
5.5 at that instance. But it was an EPA dominant oil, and
Yeah.
and that's actually what dominated the 1990s at that point. There's a lot of oils were EPA
Yeah.
dominant rather than DHA. He then brought them back after 6 weeks. And what he was measuring was their change in maximal aerobic capacity. So he had a question to say, well, and it's probably quite legitimate with the EPA. His hypothesis was that if you change the red blood cells of the membranes, red blood cells become less sticky, they become more fluid, they might be able to squeeze through capillaries easier.
Yeah.
There was also a hypothesis around EPA and blood flow, so anti-aggregation, getting kind of stuck or clotted up. So bringing back that sort of um, normal process of blood flow by having good EPA in the diet. So his hypothesis was that you could improve blood flow, and by improving blood flow, you can increase the VO2 max of these mixed athletes that he had. And what's interesting, he brought them back after the 6 weeks. Control group didn't change. His low group, inverted commas, improved their VO2 max, but his high group didn't.
Oh, wow.
And so it was a little bit sort of a confusing result in this instance, but it opened up the door that the idea that omega-3s potentially could have a role in terms of helping to support physiological function during exercise. So it was a really important study, although the outcome was a little bit confusing in terms of one group didn't, the other group did. It sort of opened the door for others to sort of say, oh, this is an interesting topic area. So if we sort of track that through, what we noted is that was 3 or 4 studies in the 1990s, 10 or more studies
Yeah.
in the early 2000s, and now we're looking at more than 50 studies in the last 10 years. So we've seen an acceleration of studies since that first study in 1988.
Do you think that result though show that in terms of the performance, whether it's VO2 max or whatever it is, the markers that we measure athletes, do you think that it's because it was a high EPA and less DHA, which obviously controls you know oxygen consumption, regulates muscle
Mm.
heart rate? Okay.
Yeah. So what's interesting is a number of us, including our lab, have looked at whether omega-3 fatty acids improve aerobic capacity in already trained individuals. It looks like it's not the case, and that's okay. The size of your aerobic engine per se doesn't change, but what the emerging story out of that is can you make your engine, your aerobic engine,
Yeah.
more efficient underneath the size of it?
Yeah.
So we're looking at, although the collection of evidence doesn't point to a high aerobic capacity, how we actually operate in terms of physiological function under there. But just back to your point about EPA and DHA, there was that was a good example. We had a clear hypothesis. His EPA was going to improve blood flow. Blood flow was going to help deliver oxygen. But if we go on to the other side and we look at it from a DHA perspective, well, we know DHA also has roles in terms of supporting vasodilator effects. So equally, you could argue that DHA could provide a blood flow role, but
Yeah.
DHA is really important in terms of cardiac performance. It's really important in terms of skeletal muscle performance. So all of those things also sum together
Yeah.
in terms of providing a basis to deliver oxygen to muscle. And when we exercise, obviously we reach a peak
Yeah.
oxygen consumption when we get exhausted.
Yeah, I'm asking that question because, despite the growing number of studies, there still seems to be some confusion about the effectiveness of omega-3s, particular regarding the types of EPA versus DHA and the dosage. What are the key takeaways from your review regarding these
Mm.
aspects? And in particular, we being in the industry, not just Omega, but many others, we see, a sway towards high EPA. But now we're talking about sports nutrition. What do you see is the right way going forward?
Yeah, so if we just sort of reflect on the review, one of the major outcomes that we noticed is, and I mentioned before, the studies per se didn't necessarily set clear hypothesis. So all the boom in studies that we've seen in the last particular 10 years haven't set hypotheses around EPA and DHA on average. And so what we've ended up with is a range of different fish oils or omega-3 supplements being used that are probably providing both. And that's logical, because if you look at where the fish oil is being derived from, you can end up with different proportions of
Mm.
EPA and DHA in those fish oils. And so naturally, what happens is a study gets designed, they use in inverted commas omega-3, they pick a supplement, and they end up with a combination of the two. So that's why it has been difficult to actually split the difference.
Yeah.
Now, in saying that, it's not that every single study has had a focus on both inadvertently. We do have some examples out of those 46 to 50 studies already that have by nature used a more predominant DHA oil. And I
Yeah.
know from our lab perspective, because we've collaborated with companies such as Omega from an industry research point of view, that when we use a DHA rich oil, even if it has a little bit of background of EPA, we know that, for example, it's DHA that's predominantly changing the omega-3 index. It's DHA that's entering into the skeletal muscle or the cardiac membranes in
Yeah.
those instances. So it's okay to have a little bit of background of EPA if you're focusing on DHA, knowing that your clear hypothesis is that DHA is entering into the cells and EPA is probably not going to be involved and will just sit in the background. But a couple of other key things around this is that around about 50% of the studies didn't really focus on the idea of what's the dose and what's the duration. And
Mm.
so if you have a look at our table that we've got studies that last for 7 days and studies that last for up to 8 or 10 weeks. Well, where's the mechanism? So what is it you're trying to achieve? So it's fine if you want a 7-day study if you're just trying to change the circulating levels during
Yeah.
that 7 days.
Yeah.
But if you're hoping to actually change cellular physiology through membrane changes, well, the study needs to be weeks. And we know that, on an average sort of 1,000 milligrams per day of EPA plus DHA, you're probably going to need a study that's around about 8 weeks in duration. And so that was the other major outcome of our review, is that the studies didn't consistently set a timeline. And therefore, if your timeline was too short, well, it's probably not unexpected that your outcomes might not be as clear cut
Yeah.
in that investigation.
Yeah. And you mentioned that the overall study or the strength of study designs has been moderate. What are some common issues with study designs in this area, and what recommendations do you provide to improve consistency in future
Yeah.
research?
So we put together a 6-part recommendation on how to conduct a good RCT, for example, but also think about that in terms of the complexity of how omega-3 works. And so in our review, we've got an infographic that sort of steps the researcher through what is it that you should be thinking about when you come to that design. So part of it is having a look at your participant population. So making sure that, for example, they're already not taking supplements or consuming large amounts of marine-based um, foods. And how do you do that? Having an omega-3 index is a good way of qualifying that they actually are low to start with. So you're going to get more opportunity to show change if you start with participants that are low.
Yeah.
But part of that also means that you are making sure that through the randomization process, your control group and your intervention is similar, if not equivalent, to start with. And in other words, we don't have sort of a mix of omega-3 intake between both. We also recommended that you need to use that biomarker throughout the process. As a minimum, you've got to do a pre and post. But what we do now is we actually track every 4 weeks in our lab to make sure that the compliance is high
Yeah.
too. And part of that is if we're using the omega-3 index, it's still just the red blood cell. And if we're focusing on muscle or heart or brain, we've got to make sure that omega-3 index is elevated to its peak potential in that time period and then sustained for a period afterwards. So in other words, you kind of nearly need to reach a plateau phase before you then go in and retest. So we recommended that as well. We also recommended in the review that you need to make sure you get some dietary information about the background diet. And so that's collecting standard food records during the process, using exclusion criteria where possible, that if you have participants that don't take part, you can use your biomarker to exclude them for good reason, but you need the biomarker to be able to do exclude in that instance. And then finally, achieve a clear separation. So if you're saying that your control group has stayed the same and your intervention group has changed, you have to make sure that you've got a biomarker to prove that. You can't just sort of rely on the fact that participants say that they take their omega-3 supplement in this instance.
So can we maybe just focus a little bit of time now on the future and practical advice of supplementation of DHA? And given your findings, what practical advice would you offer to athletes or active individuals, even master athletes, looking to optimize their omega-3 intake for training and recovery? Would you say there is a different recommendations for omega-3 intake when we consider things like dose, the duration time, EPA versus DHA for different types of athletes, such as power versus endurance?
So look, let's just start with the generalized process that if we're consuming on average 150, 200 milligrams per day of the combined EPA plus DHA, ideally we know that DHA is preferentially incorporated into skeletal muscle and heart and brain cells. EPA is also important. It's involved with immune cells. It's involved with epithelial function as well, platelet function in the bloodstream. But from a DHA's perspective, if we sort of boil it back to the evidence around the cardioprotective effects, for example, it's achieving an equivalent DHA to 2 or 3 fatty fish meals per week. So what does that look like in terms of milligrams? What it looks like is around about 500 to 600 milligrams of DHA. That's really the minimum target. Now, we don't necessarily have full recommendations across the industry, but we also have peak bodies that would then also say that 500 milligrams is the key minimum target we should be reaching, and reaching in terms of DHA in particular if we're thinking about heart function or brain or muscle function. So to do that, as I said, it is dietary translatable. So what's interesting at that 500 to 600 milligrams, it is achievable through whole foods. It may be that people don't like consuming marine sources, and so they have to look for other sources. And a supplement might be the easiest option for some people. For other people, supplements are difficult to swallow if it's a capsule, and so whole foods
Or
are the
dietary
option.
requirements too.
Yeah, dietary requirements as well.
Vegetarians and vegans.
Yeah, and so I think what's good is that we set those key targets of 500 to 600, which equates to those 2 to 3 fatty fish meals per week, and then from there you can look for the specificity of the athlete's goals. So as we've mentioned before in the previous podcast, there is still a role for moving up to the 1,000, and there's still a role for moving up to the 2,000 milligrams, but it depends on the context of the athlete. So if the athlete's hoping to achieve an outcome a little bit quicker, there is certainly a period of time where consuming 2,000 milligrams of EPA would be quite legitimate, but it doesn't mean you have to do it all year. It means that you could quickly move your omega-3 status maybe within 4 weeks rather than 8 weeks, and then you can bring that dose back to 1,000. And we've also know that around about 1,000 milligrams of DHA is quite sustainable
Yeah.
in terms of a supplement use. It's also partly achievable through food, through working with a sports dietitian, for example, and that the omega-3 index, for example, can be sustained through high intensity training at the same time. So you
Yeah.
don't necessarily deplete your omega-3 index as long as you're consistently taking in the DHA over that 7-day cycle in that
Yeah.
instance.
Different sports, has different type of demand on
Mm.
athletes or active people. So long distance versus short distance, or swimming versus running or cycling. Do you see a difference in those different types of sports?
Yeah, so it's a good point. I think the difference lies in what support the DHA will provide to different body organ
Yeah.
systems. So if you take an endurance athlete, they put a lot of work through their heart. Their cardiac function is
Yeah.
quite high. And we know DHA is really important for cardiac function. We know it reduces resting heart rate. And I'm sure we'll talk about that a lot later in future podcasts.
Yeah.
And so for an endurance athlete, achieving a minimum of 500 to 600 and pushing towards the 1,000 milligrams of DHA is certainly going to optimize cardiac membranes.
Yeah.
And that's going to be very useful in terms of providing cardiac efficiency support. So reducing resting heart rate, reducing submaximal exercise heart rate is a good example there. From an athlete who might be a shorter but high intensity, let's take a 400-meter runner.
Yeah.
So they last in what, world championships? Men are running low 40s, women are running
Yeah.
low 50s. That's ballistic activity, isn't it?
Yeah.
Okay. And so if we then turn our attention to the role of DHA in skeletal muscle, we know it incorporates into all skeletal muscle fibers.
Mm.
What's really interesting is that DHA actually incorporates into skeletal muscle fibers according to the muscle fiber type. So even though it goes into slow twitch type 1, even it goes into fast twitch type 2B, it actually preferentially incorporates into type 2A, which is the fast oxidative glycolytics. And they're supporting that sustained contraction over 1 or 2 minutes. So a 400-meter runner or an 800-meter runner would be looking to DHA at that 1,000 milligrams because they know then that the muscle fibers that are supporting the contractile activity of running at high intensity, near maximal intensity for 1 or 2 minutes is highly optimized in that instance. So this is where I'm getting to the point that each athlete, in terms of achieving that amount, is then focused on what body organ system is the DHA supporting in that instance.
Yeah.
Does that make sense?
It makes a lot of sense. Makes a lot of sense. Just in terms of the future research directions, what do you see as the next steps for research in this field? Are there any emerging trends or areas that you believe warrant further investigation?
This is a great topic, and again, very fortunate to work in collaboration with Omega on our latest research. In this instance, we're just about to publish in the next few months a study that looks at the provision of DHA through microencapsulated powder that Omega are providing for us in the collaboration. Through 2 different forms. So, we've talked about fish oil, but we know that the fish eat the algae. And so algae is actually a really rich source of DHA. So we, in our latest study, all those recommendations that I've talked about before, we have put those into place, and we just finished a 12-week randomized controlled trial where we had 3 groups. And this is the point about the really pulling apart in terms of understanding differences between DHA, where DHA comes from. So we had a classic control group on a placebo control. We had a DHA fish-derived group, and we had our algae-derived group. Now, why algae, you think? Well, what's important about that? Well, if you take a vegetarian or a vegan or a plant-based athlete, they're not likely eating any marine
Fish,
sources
yeah.
at all. They're not that they're moving away from that. They don't want to consume animal-based products, but they're happy to consume a plant-based product. And so the idea of trying to demonstrate that algae provides an equivalent outcome to fish is actually a really important step that we need to take, because there's going to be lots of people where algae is actually going to be the preferred option for sourcing their DHA. So in this trial that we've just wrapped up, and we're currently drafting our papers at the moment, we've looked at 12 weeks of algae, 12 weeks of fish versus control, but we've done that through the microencapsulated powder, where we've actually presented it in a tablet form. And so it becomes a chewable tablet then, doesn't
Yeah,
it?
yeah, yeah.
And that's actually really quite a nice demonstration of research and industry coming together in this instance, because rather than treating it, you've got to swallow a capsule.
Yeah.
It can be that for some people, chewing a
And
tablet
I've
is
tried them;
actually
they're actually very good.
they're fantastic.
Yeah.
We had very high compliance in this
Yeah.
study, and look, for everybody out there, you have to wait to 2025. The papers will be out, but just so you know, very high compliance. Everybody really enjoyed chewing the tablets. There was obviously our flavor, just like a vitamin C. You know, the orange flavor sat in the background. We used our biomarker. We took the biomarker every 4 weeks. We got fantastic uptake of DHA, both through the algae and the fish. And so, as a bit of a spoiler, there was absolutely no difference in the uptake of DHA through our omega-3 index scores between those two sources. And so what people will notice is when the papers are published is that we've then been able to statistically roll those together. So in other words, we have a control versus a DHA intervention, because we've been able to prove that the algae and fish are just the same. So why don't we just collapse those two groups together, and then we look at our outcomes. Now, we'll talk about this topic later, but this particular study was focused on recovery. So we did a muscle damaging activity in these participants before and after the 12 weeks, and we looked at the recovery over several days. And we can talk about the details of how omega-3 actually supports muscle damaging recovery later. But I think, from the purpose of what we're talking about today, is that the future lies in looking at DHA sources that are available for everyone in the population, including people that prefer not to eat animal-based products. And algae is a very good option for those people.
Well, we need to come back and do a podcast about that study once it's published, right?
Yeah, look, it's actually, in terms of muscle damaging activity, it's probably, we didn't start with muscle damaging activity in omega-3 research for sports science. As I mentioned before, Alexander Leaf really looked at it from a VO2 max point of view, but the majority of the studies that are now published in the last 10 years have focused on muscle damaging recovery, which is fascinating, because that's what you experience. You get sore, you get delayed onset muscle soreness, and you want to be able to recover so you can perform again.
Well, I mean, it's obviously evident that the focus for exercise science has been on body systems such as, cardiovascular, muscular, skeletal systems. What have we discovered in terms of the role of omega-3 on the nervous system, especially the brain? And how does this rapidly evolving area of omega-3 nutrition interact with athletes wanting to optimize brain function and recovery?
Yeah, so if I just reflect back to our review, when we filtered down the studies and looked at only studies that have focused on trained individuals, of the 46 studies that we found, very few of them focused on a neural central hypothesis, so either brain or peripheral nerve. Some of them had some peripheral nerve inferment in it, because they may have been assessing neuromuscular function. Now, we know neuromuscular function is a combination of the nerves that signal the muscle plus the contractile activity. So there is some inadvertent work being done on nerves in that way. But I think the new area is going to be looking specifically at how omega-3, particularly DHA, can support brain function. And this is not new. So if you go back and look at what do we know about DHA and brain, I mean, this is 1960s that we've known the importance of DHA in the brain. We know it's involved with good cognitive development in the early years of life. We know it's also at the later stages of life highly associated with good brain function in the later stages. So it probably makes sense that in the middle, DHA still forms a really important role in our middle parts of life. I think that's where the future is going to be. Now, there's a couple of interesting topics on that. I've had a couple of conversations with colleagues around, can it provide some role in terms of speed of cognition and thinking and reaction? We don't know, but that would be an interesting area. I think the other area that's really starting to demonstrate some real potential, particularly from a point of view of DHA and brain, is concussion recovery. And again, although that seems to be playing out more recently as new in the sports area, DHA supporting brain injury is not new. And again, if we go back to animal models, there's literature that clearly shows that if you use a brain injury model in animals and have a look at how important DHA is, it certainly does indicate quite clearly DHA plays a role in terms of mopping up inflammation associated with particularly those lower levels. So it's not a full-blown concussion, it could be those lower level knocks. And we also know in animal models that if those lower level brain injuries occur over a repetitive period of time, the DHA gets depleted in the brain tissue. So being able to continue to supply DHA to brain tissue that is more likely to experience ongoing small repetitive head knocks is likely going to be a really interesting area that I think we need to sort of be focusing on in the next 10 years.
Yeah, I mean, if you look at Australia, our two major football codes, concussion is a critical topic at the moment.
Yeah.
But if you look at today with sports scientists in these big clubs, they're actually focusing on how to get athletes to make the right decision, to be cognitive alert while they're out there in the field or running. So I think this research around DHA and how it can improve an athlete's cognitive function certainly would be great.
Yeah, and so if we just sort of focus on that concussion quickly, what we know is that when athletes experience even those lower level repetitive head knocks, brain injuries, they don't necessarily show the symptoms of concussion. There is a range of experiences of neural inflammation that occurs, and that can occur for days after. So if you take an average contact sport athlete, they're turning around and training and then competing and then training and competing. This goes on for more than half a year. So if you can have an opportunity to support neural cells, brain cells, with DHA that has the potential, the hypothesis that it could support neural inflammatory response, as in it can help mop up that inflammatory response. That is certainly going to be an exciting area. I think it's going to be a very tricky area, and I reflect back to this review that we started talking about today. I think the downside so far in the literature is we haven't designed studies very well. I would just emphasize out there to the research scientists that are out there as much as everybody else, let's get this right from now on. So in our review, we've actually given strong recommendations of how you should actually go about doing this, because otherwise we're actually wasting research participants' time. So in important topics like concussion, we need to get it right when we actually sort of perform these studies.
Excellent. Well, to wrap up, is there anything else that you'd like to share, with our listeners about the role of omega-3s in sports science or your research?
As I mentioned before, I think one area that I'm looking particularly in is the supporting anybody, athletes, those engaged in physical activity that are choosing a plant-based diet, or at least eliminating as much meat out as possible. And so I think on a number of fronts, algae form a really important part of this story. It plays a role in sustainability of oceans. So if we look at our world's challenges that we have, maintaining underwater healthy environments is going to be important. So algae could certainly play a role in that. And then we can make that part of the food chain for those that are choosing not to consume animal-based products. And then algae can form a really important part of the DHA story in many people's diets in that instance. So I think that's an area that I'm sort of be focusing on in the next 10 years as well.
Thank you, Greg, for sharing your insights and expertise with us today. And it's been a pleasure discussing these important findings. And thank you for our audience for tuning in to The Good Oil. Stay tuned for more episodes where we dive deeper into the DHA science behind sports and performance. In our next podcast, we'll be exploring the impact of omega-3 fatty acids on heart function and blood flow during physical training and competition.
When the game gets tough and you're feeling sore, Gotcha's there, it's the key to score. Healing fast, staying on your feet. With this power you can't be beat. DHA, the athlete's choice. Heart and brain.